Hundreds of patients lived that used to die because you helped design a system.
Leaders will be able to see the entire picture.
Injury is a completely neglected disease worldwide, but certainly in the United States. And we really need to do better. Our language is a little sloppy. We call them motor vehicle accidents. These are predictable events. There's nothing accidental about them. Trauma is a disease that everybody has a role in helping. And there's a prevention strategy, there's a treatment strategy, there's a rehabilitation strategy, and everybody has something to do with that.
The Masters of Trauma Sciences is designed to create leaders in the field of trauma to be very sophisticated in taking care of the injured patient. What that could mean, that could be EMS providers, nurses, physicians from all over the world, understanding the breadth of trauma care, both from a public health perspective, understanding how trauma comes to exist, what populations it exists in, and why does that happen? How do we develop effective trauma systems, depending on the location you're in and the resources that you have?
Trauma systems are incredibly important. Organizing trauma care, legislating trauma care, advocating politically for trauma care. All of these are very important parts, and frankly, you could probably save more lives by changing the system than I'm going to save one at a time.
The way we design the program is to be 30 credits online over 2 years, and the reason we did online is most of our student body will be working individuals. It's really hard to take 2 years off of your life to further your career, and we didn't want people to sacrifice that. And also, the international need for trauma education is so large that we could not exclude that population. Trauma care looks very different in the US than it does, for example, in Europe, than it does in Africa, than it does in India, Thailand, etc. And I think having a student understand those perspectives really makes them a sophisticated leader in trauma.
Here at the University of Maryland School of Graduate Studies, we offer a lot of different programs, but we're particularly excited about trauma science because it gives us the opportunity to work with a world-class, leading-edge trauma center that is Shock Trauma Center.
Shock trauma faculty are some of the best in the world, and they're just leaders in their field from a research perspective, from a clinical perspective. We'll have then synchronous lectures where you will be in touch with our shock trauma faculty, so they will be able to get to know the faculty, they will be able to benefit from their expertise and their debate and their teaching.
We have been way too siloed in the way we approach injury, right? We say it's a surgical disease, only surgeons should be taking care of it, and that's nonsense. A much broader approach to injury prevention, both physical and psychological concerns of injury are really, really needed.
I would say this is a program where you really broaden your perspective of what is able to be achieved to help save lives. I think that we all have one perspective of maybe what we are able to do, and I think once people understand what goes in to advocating to help save lives, you realize you have a place. We want students to advocate for trauma care on many different aspects, because it's not, again, just being in the hospital. That can be from, hey, like I'm a social worker, I think I can do a lot better with regards to advocating for my patients. Say you're an EMS provider who maybe wants to do a system, develop, like Thailand, for example, doesn't have a trauma system. Maybe you want to start developing that. There's a place for you to do that. You can find ways that you can then save lives in whatever way makes you feel most effective and most passionate about.
To me, this is the future. Organizing trauma care, whether that's in the US or around the world, is the next big step to really doing our best to eradicate a disease. And this Masters in Trauma Sciences, that's really at the very core of what it is we want to help people do better.